This conference will now be recorded.
Welcome to Live Talk with Dr. B. Hill. Well, our new listeners need to chat with us. There's a button up in the right hand corner of your screen that you can talk to us and chat with us and ask any question you want. So today we have returning guest Travis and Dr. Doug Smith. So, Dr. B, take it away.
Okay, thank you so much. I know we always have great things coming with Doug and with Travis, uh, discussing all of the slides and all the scientific evidence that we have. And I don't want to take the time up. I want to turn it over to them right away so we can learn more because these meetings are very, very informative. Thank you, Dr. Smith, and thank you, Travis.
Thank you, Miss
Thank you.
B.
Travis, how are you today?
Doing well, Doug. How about yourself?
Well, once again, we spent time yesterday talking about Dr. Nora Volkow, and that always just puts a damper on my day when we discuss her. But it's important that we do. And Travis, yesterday, I think for the first time, you were exposed to some of the science or lack of science that Dr. Volkow has been pushing from her platform at and there's thank you, Dr. B. There's Dr. Volkow now. That's her. um just looking at
I
the woman
wanted to
here,
start your day.
yeah, just I cannot look at her without knowing how I feel about being a physician, knowing about how I felt when I took the oath, knowing about how I feel that I'm I felt motivated to dedicate my life to helping others. And then when I look at Dr. Volkow and Travis, when I look at the stuff we looked at yesterday, uh, she has, in my opinion, knowingly and intentionally obscured the science and presented something that isn't science as if it was science in an attempt to deceive mainly physicians such as myself, and then secondarily everybody else in the country. And she has done so very successfully. And Travis, you were exposed to that yesterday for the first time. I was just wondering if after the show you had any thoughts along those lines about how you felt about what you learned yesterday.
Yeah, I agree with what you're saying, Doug. It kind of blows my mind. I'm not in the medical field, like I'm not a doctor, but I just don't understand how this is allowed. Like, if you have science to back up what she's saying that it's not true, and like you said earlier, lack of science, I don't I just I don't understand. I don't get it. I don't see how it's allowed.
Travis, you hit the nail right on the head. I hadn't thought about it. Okay. And once again, I always enjoy hearing your words. You hit the nail right on the head. You said how this is allowed. That's what you said. You used the word allowed. Uh, Travis, that's exactly it. It's not allowed. You can't do it. Nobody does it. And so what Dr. Volkow here is taking the fact that it's not allowed, nobody does it, and she has used her position of trust to do it. And because nobody else does it, nobody would think of doing it because it is so dishonest, because it is so dangerous, because it is so unethical. Nobody else would do it. And since nobody else would do it, it's called, the third rail. I don't know if you've ever been around subway cars, but the electricity goes through the third rail. So you never touch the third rail. Okay. That's the one that'll kill you if you touch it. And here what she's done is she's used her position of trust. And Dr. B yesterday laid out how many papers she's been involved in, and she's built up this persona of the expert, and then she has used our trust against us, and it
Can I
worked.
ask a question? I need to ask this big question because this came up with me after we were off the air. Isn't she committing fraud with the federal government?
Fraud includes the concept of intent, and
Yes.
none of us know what the intent is. I really don't want to see her charged criminally. I think that's a very difficult thing to do, and it would probably fail. I just want to see her run out of town. I want to see her brought in front of that oversight committee, forced to at least confront the questions that need to be asked, and then fired. Travis, I don't know how you feel about it.
I agree with that. I mean, that's exactly what I think should happen.
Travis, there isn't anybody else but us that's going to do it. We're it. We're it. We're it, and we will do, and we will get the job done. So, Travis,
But she's taking money on false pretenses, though. She's taking money on false pretenses.
I hear you loud and clear, B, and I agree with you. But as long as she's publicly humiliated and fired, I'm fine with it. It's tough to prove intent. It's tough to prove intent, and not worth the effort. And frankly, I don't want to give her the opportunity to clear her name. I just want her confronted with what she's done, fired, and passed down into obscurity. And so, Travis, what I wanted to do today, we got 3 pictures of people I want to show you, and at least in my opinion, these are the 3 people who are still in government who are most responsible for the opioid crisis. Now, let's start out with Dr. Volkow, okay? And if any viewers are just now joining us, Dr. Volkow is the director of a group called NIDA, N-I-D-A, National Institute of Drug Abuse. NIDA has been authorized by NIH, National Institute of Health. NIDA has been authorized to be in charge of all the research money that goes into opioids, alcohol, marijuana, the substances. Okay. And so it's Dr. Volkow and her crew that determine what research gets funded. And I think we spent a lot of time yesterday as to why we would consider Dr. Volkow to be one of the top 3 people most responsible for the opioid crisis. So, Travis, when we talk about your DNA being changed, and when we talk about you having passed that DNA down to your child, you're looking right there at one of the 3 people that I think is most responsible for how and why that happened to you. You may not have really thought about it in terms of people, but it's people that do things, and it's people that make decisions, and it's people that need to be held accountable. You can hold NIDA accountable, but who is NIDA? It's an organization. It's an institution. We want to take this thing all the way down to the granular level of the person who we feel is mostly responsible for what happened to your body.
I agree with that.
So there's one of them right there, Dr. Nora Volkow. Now, Chrissy, if we can jump ahead to the second one, and pick either one, Chrissy, either, oh boy, I got to get the names right. Chrissy, as you put them up, if you could please say the name of who you're putting up there so that I pronounce the names correctly. One of the names was a little difficult for me. It might be difficult for you too, but I'll put you on the spot first.
How about Miriam? We'll do Miriam. Very difficult last name. Delphin.
You want to try that again? Oh, you know what? There you go. I remember now. I actually put the name up there. Okay. Travis, can you see the full name there?
Yeah, Miriam E. Delphin. And then I can't see. Oh, Rittman. Okay. Miriam E. Delphin Rittman, PhD.
Now, this is the person that's in charge of SAMHSA, Substance Abuse Mental Health Services Administration. Now, SAMHSA is the group that is largely pushing this mental health component of the opioids. And they're getting billions and billions and billions of dollars from the federal government to promote both the concept of opioid addiction and the treatment for opioid addiction. Now, Travis, Along the way, somebody called you an opioid addict, right?
Yes, that's correct, Doug.
Did they ever recommend treatment for you as an opioid addict?
Yes, they did.
Did you do it?
To be honest, I thought about it, but I mean, I never did it. I didn't feel like at the time, I was confused. I didn't feel like there was something mentally wrong with me, and they were telling me that I needed mental health as well. And I didn't, I wanted to get off the opioids, but I didn't feel like I was crazy. You know what I mean? And that's what stopped me from entering one of those facilities, to be honest with you.
So, Travis, the very feelings that ultimately led to you taking part in our clinical trial and the very feelings and thoughts that ultimately led you to get your DNA tested had their roots sometime back, at least when you were first told that, Travis, you are an opioid addict.
Yes.
Did you doubt the diagnosis from the very first time you heard it?
Like I said, I knew I wanted to get off the opioids, but when they started throwing all this other stuff in there, I don't know if it was doubt, but I was very confused by it. I was like, I really don't understand this because I don't feel like mentally I have a problem. I know that I need to get off the opioids, but like I said, everything else they were saying, it just wasn't making sense to me, to be honest with you. And so I went to the one person that I trusted to get help, and that's what I did.
And that was when you started on the buprenorphine?
Yes, that's when I actually went to Miss B to I confided in her.
What was it that the mental health people wanted you to do? Do you remember? Was it inpatient, outpatient counseling?
Well, I had choices. It was either you could go inpatient for 30 days to detox, but at the same time you had to do it was like you had to do a mental health evaluation when you went in there, and I think it was like a 72 hour. The first 3 days you were there was a mental health evaluation while you're detoxing, which made no sense to me. If I'm not recollecting right, I mean this was a few years ago, and then let me see here. You had to do like group therapy every day. I do know that with everybody else that was in the facility. Um, but they were basically telling me that I was mentally ill as well. They were like, you have an addiction with opioids, but you're mentally ill as well. And that mentally ill part, that label that they were trying to give me is really what stopped me from going into to the facility they wanted me to go to. I mean, I had a problem with being labeled mentally ill. I didn't I was already embarrassed that I was on opioids, and for them to add that on top of it, it just made me not want to go because I
Who's
didn't
going to
want
pay
people
the bill?
to. Well, my insurance was, I think, covering a fraction of it, but really, what my insurance covered was practically nothing. I mean, to be honest with you, my grandmother was going to pay for everything.
Do you remember roughly what the cost was?
It was expensive. I don't remember the cost. I'd have to ask my grandma because she was the one that was going to pay for it, but it was a lot. Like, insurance covered nothing. I mean, it wasn't much that they covered.
These people are making a lot of money, aren't they, Travis?
Yeah, I believe so. I believe so.
What,
I mean, I know it was thousands. Like it was, and I'm not talking like 10,000. It was a lot more than that. I do remember that. I just can't remember the exact number. It's been so long ago.
so, Travis, it was when you boil it down to its essence, it was counseling.
Sorry, guys.
No worries. No, we all have families. Everything, it's all good. Need a few minutes?
No, I'm good. I just had to
Okay.
lock my door. Sorry about that.
Sorry. So when you boil it down to its essence, it's counseling.
A
It's
lot,
all
a
talk.
lot of what they were, yeah, a lot of what they were saying was counseling, group counseling every day, 72-hour observation, mental evaluation.
Were they going to put you on buprenorphine?
You know, I don't know. I didn't. I didn't ask them, to be honest, and it was never mentioned. But I mean, they just said detox.
So you would have been in withdrawal.
If they meant detox and wasn't, I mean, yeah, they just said detox to me. They never. They said it was a 30-day detox program. So I don't know exactly what that meant, but that's what was said.
Well, let's play devil's advocate here, and let's first talk about it as if it was 30 days without any buprenorphine, and then we'll talk about it as if it was 30 days with buprenorphine. So if you
Okay.
went in a facility for 30 days, no buprenorphine, went into full-blown withdrawal, are you going to stay?
Nah, I wouldn't have made. I probably wouldn't have made it the first couple of days. There's
Now
no way.
let's say that they gave you buprenorphine and you stayed for 30 days. But then what's going to happen at the end of 30 days?
Uh, I don't know that, Doug. I mean, I didn't go, so I really can't say. But I mean, I can tell you when I first started taking buprenorphine, there was a few times where I did relapse, and I don't know if that would have happened there as well, but it only happened twice, and then after that, which I mean, nothing happened because I was on buprenorphine. So I mean, it's
Why
I
do
just
people
got sick.
relapse?
I think I got sick, and then once I got sick, I never did that again.
Why do people relapse on buprenorphine?
I have no idea.
For you, do you remember? I mean, were you just even though you were on buprenorphine, were you still craving the opioids a little bit?
Um, it was so long ago I can't remember, but I mean, I wasn't sick, and I think I don't know what happened. I think I got in an argument with somebody one day, and I can't really remember exactly what all happened, but I don't know if it was cravings or it's been so long ago I can't remember, to be honest with you. I just know that I was struggling with that at first, like whether or not I was going to stick with the buprenorphine or whether or not I was gonna. I mean, it was a hard decision at first. I mean, for me, but it only happened one or two times,
What
and
about
then
now?
after no, oh no, I would never ever ever touch an opioid ever again. Never,
All right.
never.
So far, we've looked at the pictures of two people. We looked at the picture of Dr. Nora Volkow, current director of NIDA, and we put forth that Dr. Volkow is one of the people most responsible for the opioid crisis. We're also looking at the head of SAMHSA, Substance Abuse Mental Health Services Administration, and at least from my perspective, SAMHSA is a leading reason, a major reason, a major contributor to the how and why the opioid crisis, maybe not how it got started, but the reason that it's continued as long as it has. And Travis, the reason I say that is, as a physician, we're trained to make a diagnosis, and then based upon that diagnosis, you initiate a treatment plan. Does that make sense?
Yes.
The problem with SAMHSA is the diagnosis is wrong. Their diagnosis is opioid addiction, opioid use disorder. And Travis, in medicine, if you make the wrong diagnosis, you're more than likely going to give the wrong treatment plan. Does that make sense?
Yes.
So, whereas I blame Dr. Volkow for the origins of the opioid crisis, SAMHSA I look to more for the fact that it's gone on for so long because they gave the wrong diagnosis, they gave the wrong treatment plan. And Travis, I know the public's going to find this shocking, but hey, counseling, as good as it is, and none of us have anything bad to say about counseling, but counseling is not the primary treatment for genetic damage. Counseling is not the primary treatment for the loss of control of the internal organs. Counseling is not going to do anything for the people who are in full-blown withdrawal.
I agree with that. I know some of the people that I told you previously that had passed away. They entered some of those facilities and they got right out and used and then died. I mean,
You want
so I mean,
you understand why that happens, right? Their tolerance goes down.
yeah, like they get out and they try to use the same amount that they were using before they went in, and then they
Right.
overdose. Yeah, I understand. That's and it happens a lot more to the people that go into these facilities if you actually do your research about it. Um, that's one thing I do know about them because people, they don't stay the full amount of time for one, and then when they get out, like you're saying, they try to use the same amount, that they used to, and then they end up overdosing.
Travis, we'll mention this briefly, then we're going to go to our third picture. I have a theory that if we can get people on buprenorphine and then taper them down to a low dose, based upon the fact that their tolerance falls over time, I'm hopeful that we'll actually be able to measure some regression of the DNA methylation, some return to normal. I'm hoping there's a process within the body that if we can get the right set of circumstances, and I'm hoping that right set of circumstances is a low dose buprenorphine, I'm hoping we can see some reduction in the DNA methylation. That is a proposal that we will be making to the FDA. That is a long down the road thing, but my fingers are crossed about that. We've got one more picture before we run out of time here, and this is Dr. Kent of the CDC. And then Travis, those are the well, actually, we got two more pictures. My gosh. Okay, that's
You
Dr.
kind of
Kent.
brought back my memory too, Doug, when you said that, when you just said what you said, get them on buprenorphine and then taper them down. When I first got on buprenorphine, they didn't have me on a high enough dose, and I believe that's what happened with me whenever I relapsed the first couple of times, because they started me out with only like one a day, and then after that I was up to three a day, but now I'm back down to like two a day. So if I'm not mistaken, that's what happened. It's just been so many years ago I couldn't remember, but.
Um, we only got a couple of minutes here, Travis. I'm going to be real careful with our time. But tomorrow, let's talk about why I think people should always be started on 16 milligrams a day. Always. Okay. And then a few people might even need a higher dose. But then I am a big proponent, if possible, of tapering. Let's talk about that tomorrow. We got two more pictures we want to get on the screen here today, so we get all four. So we saw
Okay.
Dr. Volkow at NIDA. We saw doctor with a difficult name at SAMHSA. This is Dr. Kent, Charlotte Kent, who is she's in charge of what's called MMWR, Mortality and Morbidity Weekly Report. This is the front line for the CDC. She's the one that has missed this epidemic of cardiovascular deaths. We also directly sent her our data. She read it, didn't do a thing. So this is someone who contributed to the prolongation of the opioid crisis. And then even when confronted with your data, Travis, your DNA, she looked at your DNA, she looked at your catecholamine levels, adrenaline levels, and did nothing. Did absolutely nothing. And we got one more picture we want to show, and this is Dr. Rocha from the FDA. And Travis, this is the person, hands down, largest single contributor to the origins of the opioid crisis is Dr. Rocha, Rigoberto Rocha. There he is, right there. Okay, there he is, right there, Travis.
I know his face. I've seen his face before.
Your DNA is permanently changed. You pass that down to your son. You're looking at the man right there most responsible for how and why that happened. And the reason I say that is it was Dr. Rigoberto Rocha that's in charge of the division at the FDA that has approved the opioids without doing a thorough evaluation of the genetic impact. There he is right there. So, Travis, those are the four people. We will review them again tomorrow. But, Travis, before we turn it back over to B here, we only got a couple of minutes. Any impact to seeing these people and knowing what you've gone through and now looking at the people who could have prevented this?
Yeah, I mean, it makes me. I mean, it makes me angry. I mean, I think anyone that is going through or has went through what I did, it's going to make you angry. You know, learning about what they knew and what they pretty much held secret to the entire world. I mean, to everybody in the medical industry, and then everybody else in the world. I mean, that makes me angry. It makes me want justice for everybody and for myself, and like you're saying earlier, I think all of them should have to resign, not just the first doctor that you told me about, but I think all of them should have to resign.
Travis, why don't we hold there for today? I'd like to really go over get this again tomorrow in some deeper detail, what these people did, why they're on the list, why these are the 4 that we are calling upon Congress to put in front of the Oversight Committee. But let's get Dr. B back in on this and get her thoughts.
Hi.
Okay.
Yes, I am also angered at all of this. The reasons that it continued the way it has continued, the reasons why this is going on and on and on. And you would think, with the feelings that they have, that it is a mental illness, okay? Why does the death rate continue to climb? Why are the cardiac cases continuing to climb? Doesn't anybody look at any of this? I mean, is it am I crazy? Or I mean, it's right there in front of you and staring you in the face. How can they continue with what they are if nothing is working that they're doing? Why are they not looking for something different than what they're pushing? There's
They're
my
pretty
thought.
they're pretty comfortable right where they are, B, and they're
Yeah,
going to
but
the
they're
status.
not dying. They're not dying, Doug.
Nope,
They
but they're
are
the
alive and well.
No,
right.
they're getting rich is what they're doing. They're getting rich.
So that's my big problem. If you see that your cure is not working, then there's a problem with you continuing doing or pushing that cure.
B, we only got a couple of minutes here, but look at what they've built. Now stop and think for a second. Okay, it's opioid addiction. If the person overdoses and dies, it's their fault. If the person relapses, they weren't committed to their sobriety.
And
No,
withdrawal
no,
doesn't kill you,
no.
okay?
That's what makes these people so dangerous. They take no responsibility for their actions.
No.
That's
And
what
what they
so
do is they
take
blame the patient. They blame
right,
the patient. And
blame the
that's
patient,
1,000% wrong.
and they take no responsibility for what they've done. None. And they won't ever take responsibility unless we hold them accountable. And Travis, that's where you and I come in.
We will. We're going to. That's my plan, and I know that's your plan. So, it's time for them to get in front of the committee, like you said, and answer some questions. And there needs to be some punishments, and that's what needs to happen. They all need to resign, if you ask me.
And look
And
who
Luther,
just left it. Hey, Chrissy.
Hey, well, thank you guys so much for the information that you gave today. Very, very informative. So thank you, our listeners, for joining in with Live Talk with Dr. B, and we shall all see you tomorrow, every Monday through Thursday at 12:30. Thank you.
Thank you.